Hello, thank you for the introduction. So GURP has supported me quite a bit throughout my career. I've also been at University of Chicago since I was a medical student, and I joined Dr. Chang's lab as a fourth-year medical student in 2005. So the GURP Associates Board supported my research as a GI fellow and has, of course, made our pouch research possible throughout the years as well. So I think as many of us have told you about over the years, this pouch project has been going on for about 10 years now. We've had NIH funding at certain points. As Dr. Chang told us, we're fortunate enough to just have received another NIH grant, but it certainly would have come to a grinding halt over the past 10 years if it hadn't been for GURP to continue supporting it and to continue it to keep going. I'm a translational researcher at this point, which means that I'm sort of the link between the patients and caring for the patients and the lab, and our scientists like Eva or Marin. And I'm the one that talks with the patients and collects their samples and does their pouchoscopies and explains why this study is important and what we're finding out and why they should keep doing it, and explains to the people in the lab what these samples are and what was going on with the patient at the time, and how their symptoms and their clinical histories sort of inform how they should interpret their samples and their experiments in the lab. So as you may have heard before, with ulcerative colitis patients who haven't responded to medications to get them into remission or have developed precancerous changes or even colon cancer, they undergo surgery to have their colon removed and have this J-pouch fashioned out of the end of their small intestine. Small intestine was previously healthy in an ulcerative colitis patient, but some of these patients will go on to develop inflammation in their pouch, and which may respond to antibiotics and heal, or might need to go on and go back on medications that control inflammation, much like the medications that they were on prior to their colectomy. We don't know why some patients go on to be healthy and why some develop inflammation again and have to go back on medications. We know that these are susceptible patients. We know that all patients that get the J-pouch are susceptible to inflammation, unlike the general population where we don't know who is going to get ulcerative colitis or who is going to get Crohn's disease. So this represents a unique population in that we know that they're at risk and we know who they are, so we have a leg up in that regard. We know that pouchitis, at least sort of the initial symptoms of pouchitis, often develops shortly after these patients get the surgery. So it's a sort of a time frame that we can study closely. And what we're trying to answer are there certain changes in the bacterial community in the pouch? Are there changes in which genes are turned on or turned up or down in the pouch lining that can predict who is going to get inflammation or not? At this point, even though we know pouch patients are susceptible to inflammation, we're still acting reactively. We're still waiting until they develop symptoms or they develop problems and then trying to treat it and trying to play catch up like we did with the ulcerative colitis or Crohn's. But we sort of have a unique opportunity here where if we can figure this out and figure out who's going to get inflammation, we could get ahead. And maybe we could start treating them and we could do something differently so that we're not playing catch up and we're actually preventing inflammation from occurring. So thank you very much for your support for the project, and it's a pleasure to talk with you about it.